Welcome to Tech Innovation for those who have just joined us. Let's hear from key industry players on their key learnings and developments to transform healthcare in an unprecedented era. Should you have any questions during the presentation, please type them in the Q&A feature on your screen. Your questions will be addressed during the panel discussion towards the end of this keynote. We have Siow Li from Siemens Healthineers, who will start the keynote session with the thoughts on how AI-powered solutions can be enhanced to transform care delivery, expand precision medicine, and improve the patient experience.
Good morning. Thank you for the kind introductions and warm greetings to all online attendees. First of all, I would like to thank IPI for inviting me to share Siemens Healthineers and my view on the topic of artificial intelligence in healthcare. The use of AI is rising in all industry segments. Healthcare is no exception, especially in Singapore. Thanks for the foresight of the ministry, we have gathered significant amount of healthcare-related data, which is a good start to support data mining and data-driven approaches to help industrial standardizations, to minimize errors, and potentially help in a certain extent the challenge of manpower crunch. I would like to start with a brief introduction of Siemens Healthineers. The company was founded in 1847. It is 170 years ago. So we are now a 65,000 employee with headquarters in Germany. One of our core missions is to enable healthcare providers to increase their values by equipping them with our innovative technologies and services in the areas of diagnostic and therapeutic imaging, laboratories diagnostics, and molecular medicines, as well as to work as a value partner with healthcare institutes to implement digital health solutions and enterprise services. When it comes to the field of AI and the use of its applications, we see many players in the industry. The core strength of us is that we bring our substantial resource worldwide, our highly trained manpower and the close collaborations that we have had with many of the world's renowned centers. Currently, we have more than 100 million curated images and data sets available from our wide install base. And we are holding more than 600 patents related to machine learning, and many of its applications are currently available in our medical devices that we produce. So let us now look at the overall healthcare landscape. We know that digital transformation has approached healthcare, and the pandemic has accelerated the speed of its adoptions, and the coverage is very broad and diverse. Today, more than half of the healthcare providers face issues with data access and also integrations, especially in our core business of medical diagnostic imaging. The scope of the AI algorithms for many analysis and also decision support, and it is very promising, as shown by the large commercial interest here, and we have known that it is upcoming and will remain for many years to come. If we take a broad overview of the use of AI here, we can see the technological impact at multiple levels. With increasing data complexity required, if we start with the lowest hanging fruit here, improving machines' performance through examinations workflow is one of the typical examples that we can apply, image reconstructions and etc. and etc. Next, to move up to the basics analysis, to assist humans in organs measurements and disease detection, diagnosis with varying autonomy. And we've moved out on a higher level is the ability to use a patient's result to customize his treatment. Finally, we aim to use big data to improve healthcare results on a population's level. One key area that we see the greatest impact is on the personal level. We need to look at it at the whole patient's journey when somebody is sick, or even before they become sick. This affects all of us, The common thread to all patients, if you can see here, is the following. Regardless of the illness or the scenario, the treating physicians needs to make a diagnosis, then move on to decide on treatment and evaluates the results while taking into account all the patient's past medical history. So if you look at that across the line of the thread, and while we look at this, we cannot look at it only at the level of the patients itself. Having this in mind, we need a holistic and comprehensive approach. Over the last 10 to 15 years, with the help of the well-curated data, AI studies has gradually developed from an organs to systemic level. And the goal in future is to encompass data across the entire human body and potentially to even digital twin our vital health assets, such as organs and other important information and also physiological data of a human being. As mentioned, the patient journey is a complex one with myriad possible decisions. For example, how often should we perform medical imaging? When is the best time to initiate treatment? The right decisions will often have to be customized according to the patient's specific diseases, according to the accepted evidence-based guidelines of the scientific community. This is very much similar to the analogous to a GPS system. While you use it to find the optimal way to get from your locations to your destinations, AI can be applied in that manner as well. So I would like to share that example of the use of AI applications to support physicians to manage patients' journey. This is the example coming from Siemens Healthineers. It is called an AI Pathway Companions. So these applications compares the patient's clinical status against the current guidelines, and through a decisions diagram, easily show you where your patient is and what the options are for the next steps in diagnosis, and then subsequently the therapy. In the future, we also want to incorporate data from patients' cohorts into the calculations so that you and your patients, or even clinicians and the patients, can always make decisions based on an even more well-founded database. Of course, the aim is to create a single source of information for data-driven decisions making along the entire clinical pathway for the patient's benefits. I would like to also share another important information. This in the diagram that you see, Team Play is a digital marketplace that Siemens Healthineers hosted. We know that there are many other great ideas and products and different leaders in their different industry in the field. So this AI landscape is not only limited to products that Siemens Healthineers has developed. This platform allows integrations for all different AI applications among different developers. And we have already partners with many such solutions that you have seen here. I welcome you and encourage you to also go Google and find if there's any opportunities to partners. As for the non-commercially approved projects under the research and development scheme, we have also another platform. This is typically a platform that we share amongst the different universities and also research body and research institutes. It is called Vuchkovikj Frontier. And there are many of the different innovations that we support that start on a smaller scale. It can be in the laboratories and other research setting. It is an advantage of this as you will be able to access all the AI platforms and the wide range of different collaborators who would like to test their prototypes. They can upload it here and share it among the different researchers across the world. So riding on the available platform, this allowed you to make use of the common data handling infrastructure, which have already been security cleared. And this will also enable you to focus purely on the algorithm itself and also get the feedbacks from the different users around the world. So I would like to invite you to be a part of this exclusive global networks, because it gives you and us the access to the different R&D prototypes, and also access to the different key institutions that Siemens Healthineers partner with. We can even roll out a multi-centers or multinational studies for the benefits of the various parties that's participated, and later on subsequently help in the commercializations of that applications itself. So you are allowed actually, by using this platform, to also show off all your applications and easily find whoever partners that have the share the same interest as you, and they will be getting in touch with you through the platform as well. Lastly, to summarize, as what we have already shown here in many of the useful tools, Siemens Healthineers is a player now that we would like to actually encourage many of our partners here to focus in where we would like to develop, and we would like to also seek partnership with you. That's all. Thank you very much.
Thank you, Ailey. Next, Quentin Soulet de Brugière from Dreem will speak on the importance of sleep for our physical and mental health, and how breakthrough screening, diagnosis, and treatment tools can improve sleep quality. Quentin?
Hi, good morning. I'm glad to be there. I'm going to present you what we do at Dreem and how we use deep technology to reshape sleep care. So today in the world, more than 30% of the world is suffering from sleep disorders, untreated sleep disorders. It's mainly sleep apnea and insomnia. And the cost only in the US of these sleep disorders are about $400 billion per year, which is very, very high cost. It's actually higher than the cost for diabetes, for example. That's 2% of the US GDP. And it's mainly due to the link between poor sleep or sleep disorders and a more serious disease like cardiovascular disorder, metabolic disorder, mental health, a lot linked with insomnia, or also neurodegenerative. What we want to build at Dreem is a world where sleep care is efficient, accessible for everybody to improve sleep, but also health for everybody. To do that, we merge a team that is quite particular, quite unique in the field. We merge a team with experts from sleep and sleep medicine and experts from deep technology. So my background is physics, chemistry, and applied mathematics. But we've got also some very high profile in sleep science. Our chief medical officer, for example, is a neurologist from Stanford University. Or we also work, for example, with Anne Rezer, who is the former CEO of ResMed, one of the largest sleep company for Europe and Asia. And we have in-house a lot of transdisciplinary people with skills ranging from sleep medicine, healthcare, electronics, chemistry, neuroscience, but also UX, design, etc., etc. And so we want to address the field of sleep because today the sleep care is broken. The cost that is paid by payer every year in the US is $50 billion. So that's a huge amount of money that is paid for sleep labs, sleep medical devices, sleep drugs, etc. But on the other hand, the percentage of people with sleep disorders that are correctly treated is below 1%. And that's one of the only fields where there is such a discrepancy. And you can explain that by mainly two factors. The first one is the underuse of technology in the field of sleep. And the second one is the complexity of care navigation. I'm not going to go into a lot of detail, but if you're a patient and you want to get diagnosed and get treated for sleep disorders, that's very complicated. You've got a lot of different players. You've got a lot of drop between all of these stages, which makes that in the end, most of the people remain either undiagnosed or untreated. The technology that is used as well for diagnosis or for treatment of insomnia or for treatment of sleep apnea remain quite far from what is today possible with modern technology. So few figures to illustrate that. We have today more than 85% of people with obstructive sleep apnea that remain undiagnosed. 90% of the insomniac people are not managed. Less than 1% of the people that have insomnia follow CBTI, so cognitive and behavioral therapy for insomnia, which is a first-line treatment. Sleeping pills does not treat insomnia. If you are insomniac, you take pills, you will sleep. But if you stop taking pills, you are still insomniac. CBTI does treat insomnia. The compliance for CPAP, the device that push air for sleep apnea, is very low. Less than a half of people who are under treatment will keep their treatment after only 6 months. And the NPS, so the satisfaction of the people in sleep clinics, are very, very low as well. So what we do is that we merge sleep medicine, the best practices of sleep medicine, with deep technology to reshape sleep care. So we are building a digital sleep clinic or virtual sleep clinic. And we have 3 elements in our clinic. So the best healthcare professionals, digital coaching and AI, and the best of medical devices, most of them that we build ourselves internally. We provide large-scale screening, general sleep improvement, all that on all the population, even before the people go to the clinic. For the people who need really to enter a sleep clinic, we have telehealth consultation with expert, at-home diagnosis, and treatment of insomnia and sleep apnea, all that done remotely. We use all along the journey deep tech modules or devices, either to screen, to coach, to diagnose, or to treat sleep disorders. Briefly, and I'm not going to detail too much, but we've got a device that can automatically screen OSA or insomnia. We've got an app that provides that reproduce a device that a sleep doctor would give to a patient that can treat insomnia with cognitive and behavioral therapy. We've got a device that is equivalent to a polysomnography to assess sleep in a much more comfortable manner. And we are in the process of developing a new generation of CPAP to build a device that people will want to use and love to use instead of being a medical device for a treatment. We sell what we do directly to the payers in the US with 3 simple arguments. We have a higher patient satisfaction, we have lower cost of care, and we have improved health economic outcomes because we treat insomnia and because we increase adherence to the treatment for sleep apnea. The other very important aspect of what we do is that we don't only treat people when they are sick, but we prevent people from being sick. We offer to all the covered population access to general sleep improvement, CBTI for insomnia if needed, and a screening tool to identify the patient who needs the most the therapy. And so patients have access to our digital tool, and if needed, they can enroll into the digital sleep clinic. We are not only doing using our technology inside our clinic, we are also partnering with a lot of different players to use our technology in their research or to deploy our technology at larger scale. Today, we've got, for example, for the Dreem headband, so the device that is equivalent to a polysomnography to assess sleep, also measuring the brain activity. We have a bit more than 300 research labs that are using Dreem in their clinical research. I cannot describe all of them, but for example, one of the research that I like a lot is we are using our device to identify patients with Parkinson's disease 5 to 10 years before the first symptom occurs. When you see some particular biomarkers in sleep during the night, and these biomarkers are called REM behavioral disorder, you can know for sure that the patient will start a Parkinson in 5 to 10 years. So that's one of the research that we have. There are hundreds of other topics, but this one is interesting. Other interesting topics that we are exploring and that show our ability to deploy our technology directly into the home of the patient remotely. We've got 2 headbands in space to measure the sleep of the French and the German astronauts. And we also have a research project in Antarctica when we measure sleep of scientists in extreme conditions. Last project that I want to mention because I like him a lot as well, that's the Hypnos Project. And so it's not started yet, but we are working a lot with the French government and a lot of players on that. We want to deploy on all the French population, so 67 million people, free access for digital treatment for insomnia. So that's called CBTI, Cognitive Behavioral Therapy for Insomnia. In France, you've got 67 million people, 15% of the population is insomniac. The cost of insomnia in France is roughly $25 billion per year. And we want to give access for free to all the population to a digital therapy for insomnia. That's a project that is carried by us. We are leading this project. Also, the Parisian hospitals, research group in Grenoble, the Health Data Hub, which is a big platform gathering all the health data in France for research, and Air Liquide, which is an international company. Not only this project can help us treat an entire population from sleep apnea, but we also intend to use the data generated to be able to develop new biomarkers to identify evolution of pathologies or see the link, better understanding of the links between sleep and other disorders. So that's just a brief overview of what we can do in 10 minutes. But we do believe that if we manage to improve sleep at scale, we can improve health for everybody, not only in France, but in all the world in the years to come. Thank you very much.
Thank you, Quentin. Following Quentin's insightful presentation, Professor Tatjana Baevska Vuchkovikj from Nikob Medical will be sharing how technology, innovation, and cross-border collaboration between Macedonia and Singapore can open new opportunities to counter disruptions in the flow of essential goods, medical supplies, and travel during the pandemic. Tatjana?
Hello from Skopje. Good morning, Singapore. It's a really pleasure to be part of this event, Techno Innovation 2021. And it's a pleasure that I can present the private health institution where I work. My title is Innovating Beyond Beyonders to Keep Borders Open in the Pandemic. And I will present this in the next time. Nikob Lab and Nikob Medical are two private health institutions. They are new in our health system. We provide health services for the medical in the primary health care, but for the laboratory, which is biochemical and molecular diagnostic, we provide services on the secondary level. Nikob Medical is a private health institution which is available to the citizen through appropriate health services at home, at work, 24 hours a day, available telephone medical communication, medical transport, and medical security of public event. We provide this by 20 highly trained medical teams that include doctors and nurses, equipment with modern ambulance in our country, and connected to an application we integrate monitoring system to be in disposal of the users for fast, affordable, and quality health services. Nikob Medical is 100 private investment, and our motto is to be the right answer comes at the right time for our customers and our patients. We provide this home care by visiting people at home or at work, making diagnostic and treatment, and we do 24 hours a day, 7 days a week. We also give emergency interventions, also by 24 hours, 7 days a week. They can reach us by our call center or also by our application. In our portfolio, we have preventive packages whereby laboratory exams, so we can prevent some chronic disease or find some new disease that are upcoming. Our 24 hours a day phone consultation is available for the whole country, and by the law, every public event, even this political, cultural, sport, needs medical security. Also, in this time of pandemic, we take care for the people with COVID infections. We go at their homes to give them treatment. Also, make transports by giving examination or intervention or taking in the hospital. Our medical services in the part of the transportation is from home to institution, from institution to home, from institution to institution, in the city, in the country, and abroad of the country. Our farthest destination till now is Istanbul, Turkey. This is I present my application for how you can reach us. In the other part of the private health institution, Nikob Lab, it's a laboratory on the secondary level, which is improved biochemistry and molecular diagnostic in clinical biochemistry, microbiology, endocrinology, immunology, transfusion medicine, molecular biology, etc. We have the high tech of the equipment, and we use all the medical standards for the diagnostic. Our services by the laboratory is the latest generation of techniques and the reagents for the fast and accurate result, examination of all organ and systems, prophylactic examination and diagnostic package offers, monitoring of COVID and post-COVID patients, mobile teams for safe and secure taking samples from the home or the workplace, consultation with specialists, modern and advanced genetic tests, detecting and differentiation of the SARS-CoV virus, examination of a male and female infections, and operational available through the distant point. By the COVID-19, this is one of our point focus where we are taking the examples and we are trying to make a difference between the people which are COVID positive and COVID negative by all the recommendation of the World Health Organization. Improving the diagnostic in this part of the pandemic beyond the borders, we connect with you, with Singapore, and we are only in the region. We are certified to use the RT-LAMP quiz for COVID testing. This kind of quiz is a molecular-based platform technology for point of care. It's easy for working. It doesn't need a specific areas for the place of the equipment. We use only, it requires a tiny amount, a nasal swab or saliva. And the advantage of this is that in the first 5 minutes, we can get the positive, and until 60 minutes, we have the negative results. In the whole period, we made almost 60,000 COVID-19 tests, and almost 1,000 that are making positive. And this improved our kind of diagnostic and made us different from the other laboratories. And we are a good example for improving technology. And beyond the borders, we are making investments in this part of diagnostic. As my conclusion is that we are new private health institutions in our health systems, but we are trying to improve the levels and the quality of the giving the services, because in this time of pandemic sometimes was very hard to reach the hospitals, and we are trying to make closer this kind of the services to the people that we need our help. The borders, we are trying beyond the borders to make innovation, technology, and discoveries in advanced scientific and technology fields. And also we are trying to be the good example in our system. In the future, we are planning to make a diagnostic center on the secondary level, and every our customer or patient can make all the exams in one place. Health and safety are the most important factors for the healthy, quality, and safe lives. And we are here in the system to provide all these needs for the people when they need us. And I hope that in some other times we will meet each other beyond the borders, because in this time we are using this kind of communication, and I'm also pleased and thankful for the chance that Nikob Lab and Nikob Medical are part of this techno innovation in Singapore for 2021. Thank you very much for the opportunity, and we are here and open for new investments and new innovation for making the better chance for diagnostic for the people. Thank you again.
Thank you, Tatjana. As we will be moving on to the panel discussion segment, we would like to encourage you to submit your questions in the Q&A feature on your screen. Professor Ignatius Arasia, Professor, Institute of Engineering Leadership, National University of Singapore, and IPI Innovation Advisor, will be moderating this panel discussion. We will invite our 3 keynote speakers back on screen as well. Ignatius?
Thank you, everyone. Let's continue our discussions. And I first want to thank our panelists for giving such a nice introduction to all the efforts that they are doing in the whole area of health and wellness, particularly on the digitalization space. And we have already received quite a number of questions here, and I want to thank the participants for your enthusiastic questions that you've posed. Now, I want to just add that Quentin had given a perspective from a startup, while Ailey had given the view of how an age-old company in the healthcare space has gone into digitalization, as well as Tanya, who is from a healthcare institution, and how they have begun to adopt the technologies. Now, there are very specific questions that have been raised, and I'm thinking of just jumping into some of them directly. And let me post, Tanya, since yours was the most recent talk, and there was one question specifically about the PCR diagnostics in the world. And about, there's so many of them, in PCR diagnostics, but you've spoken about cell ID quiz biochip. What's so unique, what's so special about this particular biochip? Would you be able to speak about it?
Yes, of course. The special is that this kind of equipment is in the part of a point of care system. You don't need a very special place. You can take this kind of equipment everywhere, not only in the laboratory. You can take this in some workplace when some manager want to make some samples from the employers. You can take this equipment to a school to make a screening of the children. The way of testing is very simple, because you need only a very simple sample. You can take only a saliva or from a sample from a nose. Also, it is good that in only 1 hour you have the complete result. In the first 5 minutes, if someone is positive, this kind of technology detect the positivity of the COVID-19. But if it's negative, we have to wait until 60 minutes. And it gives us advance in other laboratories, and especially we are popular at our customers who want, or if they need a test for only 1.5 hours or 2 hours, we can reach this point. And the kind of education is also simple, and all our workers, which are trained by the people that were coming from Singapore here. I'm very thank you for your colleagues and my colleagues, and our vision of improving in technology and diagnostic make us kind of the leaders in the region, not only in our country, but in the region, in the countries around us.
Thank you. Sorry, go ahead.
Yes, and it's important, as is the title of this session, Beyond the Borders. We are trying to improve the services in our system, and we are very thankful that we are connected in this way, and we are open for new investment and improvement of diagnostic, because it's one of the ways that we can reach all these services to the people that need our help.
Amazing. So thank you. That's very interesting. So it's just not the technology, it's how it can be adapted into your situation and environment, and how now it gives you not just a solution, but an edge, and as well as the ability to go beyond the borders. Thank you for that. I'd like to now turn to Quentin. You spoke so well about your technology, but we have a question here about how your solution competes or even complements with existing practice in sleep clinic.
I think, well, the first thing is, so we are, in the US, we operate as a digital sleep clinic. So we have in-house medical staff, and these people uses our technology. So that's a model that is more and more widespread at the moment, is we build clinics and we have the staff of our clinic using all the technology to be more efficient. So in this sense, we are another clinic that could compete with other practice. And we say that we say both to payers and to patients that coming to us and having care in our practice would drive better outcomes than other clinics. So in this sense, that can be a competition. Yet we have two important points as well. The first one is that the number of sleep care providers or healthcare providers for sleep is way too low compared to the number of people who are suffering from sleep disorders. So in a sense, having another players, even with technology that is on the field, is not so much a direct competition for the clinic, because the size of the pathologies is much higher than the ability to handle it. And the last point, which is also, I think, very important, is that we have our practice internally with our technology, but we allow also other clinical practice and other clinics to use our technology. And so we want, in the end, to make the whole system more efficient. So a part of it is competition in the sense that we provide some service, but most of it is collaboration, as we want other practice to use what we build.
Thanks, Quentin. Interesting. So it can be a competition. It could complement. Okay, so it depends, and you have different circumstances. There's a slight follow-on question here. With the COVID, with the current climate that we have, would there be an impact on sleep and sleep insomnia? Have you seen in your work that there is a significant effect of the COVID on sleep?
Yeah, well, first thing is we are a digital healthcare provider. So the main impact that we see is that COVID has enabled digital health a lot. So that's the main impact that we see. If we look at the particular case of COVID and the particular case of sleep, excluding the digital part, COVID has indeed created much more anxiety, and this anxiety has led to higher insomnia. So we've seen an increase in the number of people suffering from insomnia. We have also seen an increase in number of people suffering from OSA. OSA is something that can be linked to obesity, and COVID and lockdown period made a slight increase in the obesity, which also made a slight increase in OSA. So in the end, sleep disorders has been more and more, it's already something that is huge at 30% of the population, but COVID again made that a bit rough.
Yes, I think there's a general sense of that. Thanks, Quentin. And I'd like to now move on to Aili. Aili, we have quite a few questions, particularly because it's AI. And there's this question about regulatory acceptance of AI and machine support decision systems. And then I'll go on to other areas, but maybe you could speak about what are the challenges you're facing in the regulatory space in terms of adoption of AI and machine learning.
Yeah, I think we have come a long way. If you look at how that was shared, that we started about 15 years ago. Yeah, so there will be actually a focus. Within Siemens Healthineers, we have a dedicated regulatory clearance teams that we have a close communications and close engagement with the major, like for example, CE in Europe, as well as FDA in USA. Generally, we will, it is a two-way communications and the dialogues. I think when we started with this communications with them on applying these applications, I think initially they actually posted a lot of questions, and then eventually I think now AI is being used everywhere in all our applications, not only for Siemens Healthineers, I think many of the other devices as well. So it has come to a certain majority if you come to the FDA handling of that as well as CE. We do see that they have cleared multiple AI applications from both of the bodies as well. Of course, different geographical across the regions, different countries will have your own regulatory requirements like HSA. So in HSA, generally, they would like to see your use case as well as also how FDA has cleared it, and there are certain dossier and informations that you have to do it. Yeah, so we normally follow a process and a close engagement with the different regulatory bodies in order to get all the applications cleared. It is not always first time submissions that you will clear it, but of course with the understanding and the use case, it helps.
Thanks. So the use case, very important, and also it sounds like you've gone through the whole journey of regulatory approval for AI and machine learning. I kind of noted there that for HSA, local regulatory bodies like the HSA, they like to have the reference regulatory bodies approval. So there's a bit of comfort there. Thank you for that. That's very insightful there. But if I could drag you a little bit further into this whole space, adoption of AI, it's not just the regulatory, it's also the healthcare professionals. So we have another question asking, do you face resistance from clinicians, hospitals, and elsewhere adopting AI, and how do you overcome them? I think this is going to be very interesting for some of our listeners because particularly startups are, wanting to figure out how to get over this potential hurdle.
Yeah. So there are different types of AI applications if we move across different levels, right? So in terms of operating AI to help operations, this I would say that it is, even though we call it a low-hanging fruit, it is the easiest to be accepted. Yeah. And when it comes to like clinical decisions making, yeah, so what we are currently working with many of the clinicians like radiologists and physicians, I think when it comes to the use of AI, many of the clinicians, they are open and they also welcome this concept. But what they would like to see is the various use case that can be applied as a complementary towards the combined force and the strength between the experience of the physicians as well as the added values that the AI applications bring across too. So it is a mixture of both, of adopting and getting used to this kind of applications, as well as finding again the use case that they can actually widely use. So the adaptations on the operations wise, no doubt, I think everybody is using this. Many times they are using this without their own awareness that they are using this. Yeah, because it has been formed as part of the features when the whole technology being delivered. But we come to the diagnosis and the decisions making, I would say that it will still need both parties within the developer as well as the clinicians to work hand in hand in order to find the deployment strategies on that.
Thanks, Eileen. Interesting. So try to go complementary along the clinical pathway with the physicians, and then try to increase the adoption rates. Thank you. That's very interesting. So, you know, Tanya, you're sitting there from the healthcare institution. You're a pediatrician yourself. Let me then throw the opposite side of this question. Could you share your experiences and challenges in implementing or accepting technologies? So there was a question asking about how you, what are the challenges that you face as a healthcare institution and a clinician yourself, both in essential and primary healthcare, in adopting this kind of new technologies? Could you speak a bit?
You mean in new technologies of the biochip, or?
You could use biochip as an example, but generally, what are the challenges do you have?
Absolutely, yes. Eileen is working in this part of the Siemens. Our next level will be in growing in secondary healthcare in the part of diagnostic center, where we will be make equipment only in the high tech by digitalized equipment, which will improve the faster and the safer approach to the people in the part of diagnostic, especially in the part of the children, because in the regular and the protocols of working in or in part of the diagnostic, always is better to have the high tech of diagnostic in part, as I said, in the saving of the time, but especially in the saving of the sequences of the diagnostic, especially in the part of the radio diagnostic part.
So saving time. And you mentioned, because we are trying to understand from the healthcare institution what you're looking for in this kind of new technologies, and it sounds like time is one concern. What were the other challenges you have that you want to see in these technologies that can help you adopt them?
Yes, absolutely. Time is always very important because if we give this kind of diagnostic at 10 or 15 people, we can improve this to give to the more people, because Macedonia is a small country. We have 4 regional clinical centers in the state, but Skopje as a capital of the city is usually the health point of the biggest diagnostic, and the most of the people live in the capital of the city, and in that way we always want to be first step before the others to make improvement in part of diagnostic, because in some kind of our hospital we still have old equipment which we know what can be the sequences when we use that kind of equipment. That's why, as we start these 2 private health institutions, as we are leaders in the part of laboratory diagnostic with the biochip, we will try in the future to be also the leaders in the other part of diagnostics, especially in the digitalized equipment.
Thank you, Tanya. Now, you talked about Skopje and serving the regional areas and so on. And obviously, there are differences from the city folk and rural areas. So, Quentin, I'm going to slide this to you to ask about, in your area of innovation, do you see how this diversity in terms of cultural and even sometimes nationality differences? You talked about how you want to try to get your solution to a majority of the people with sleep insomnia problems in France, for example. Do you see how the differences, and this was one of the questions, do you feel the technology adoption may be culturally dependent, and how does that influence adoption, and how do you go about that area?
Yeah, I think it's a very important point that you raise, and indeed, well, there is no one size fits all for a lot of things, and particularly not for digital health. The good thing with digital health is you can adapt, personalized a lot all the content because it's very easy to have one version for one type of population, one version for another. And for example, between so the principle of cognitive and behavioral therapy, the type of advice that a doctor gives to the patient, you've got the content in itself, which is important, but most importantly, that's the way you are going to deliver it to a patient. And it's true if you look at two different countries, the psychology can be different and the way they will accept the content and act to change their behavior to improve their cognition depend a lot on the countries. And even inside a particular country with a different type of population, you need always to adapt and personalize what you do. And the beauty again of digital health is that each time that you've got patients that go through your program, you generate real-world evidence, and you can use this general evidence to see what is efficient, what is not, and how you can personalize and improve. So again, yes, very much strong need to adapt and personalize the therapies.
Okay, so customization and personalization is an important element. I'd like to now move on to Aili. Aili, you've heard from Quentin how they have thought about customization. And I know personalization is an important element that you all look into. Maybe you could speak to us a little bit, and there were questions about whether there's a possibility of public patients obtaining third-party teleconsultation and submitting medical images for diagnosis, etc. That was a question, but I think it links to this whole aspect of the variety of people, the cultural variations, as well as the ethos in different places. Maybe you could speak about how Siemens and Healthineers are working in the space, and what do you see in the region? You have such a wide experience in the region. How do you see adoption in this space?
Okay, so when we want to embark on the studies, and of course, there are different kinds of studies that, first of all, we need to look at the outcome of the study itself, what kind of AI algorithms that we want to do. It can be maybe a certain disease or flare predictions. It can be on wider scales like health populations that includes wider health populations and so on. I think all these different studies require different data sets. And different data sets that is within the control of the mixture of the data sets needed to train the different algorithm. Yeah, so we have actually in the past different experience with the different cohorts. So we do have certain studies that train a certain algorithm with the smaller cohorts. That doesn't require this kind of heterogeneous data sets and so on. But we do have some populations have diseases like what we have that have shown like AI companions or rat companions that we run multiple studies across America, Europe, Asia, that we have different collaborators to help us in different data acquisitions and data collections in order to make the studies possible. Yeah, so I think when it comes to AI algorithms and also the studies, the scientists will then define and actually recruit and work across the different partners that share the same strategies. Yeah.
Thanks, Aili. That's very interesting. So a bit like Quentin and Tanya also spoke about adoption into their own practical reality and the need of the cohorts, like you talked about heterogeneous requirements sometimes. So I see how you have to bend to whatever requirements there are in those different areas. So with that, we are coming down to the end of this session. Unfortunately, we are not able to answer all the questions because we are running out of time. Just safe for me to thank all of you, and Quentin, thanks for that wonderful talk that you gave us on the whole area of sleep from a startup standpoint. And thanks, Aili, for taking that to the whole multinational that traditionally was there in the from the beginning, for hundreds of more than 100 years, and then now moving on to the digital and AI space and the challenges that you have faced. And finally, Tanya, you receiving all of these technologies, and thanks for that example of the chip from Singapore and how you've been adopting, and that's a wonderful full cycle of how we can bring the innovations and digitalization into healthcare and adoption and we've heard it from Macedonia. Thank you one and all, and I want to also thank the organizers for putting this wonderful session for all of us. Thank you and have a good day. Bye for now.
Thank you. Goodbye.
Bye.
Bye-bye.
Thank you, everyone, for your different perspectives on developing healthcare innovations in the new norm. We've come to the end of the first keynote session today. Thank you to all attending this webinar for your active participation. We hope that you have benefited from the insightful presentations. Please click on the info button on your screen to submit a rating out of 5 stars and your feedback before exiting this session or joining the next one. Our next program is on reimagining health and wellness solutions post-pandemic through human-centric innovations and designs. We will see you shortly at 11 a.m. Singapore time. Thank you.